Taoiseach, I'm returning to a topic that I raised with An Tánaiste here in Leaders' Questions last May regarding the diagnosis and care pathways for patients with rare diseases. And despite their name, rare diseases are not rare at all. We all know someone with a rare disease. In Ireland, about 1 in 12 people are, or at some stage in their lives will be affected by such a condition. This means that approximately 825,000 Irish people are impacted by a rare disease when family members, many of them whom are carers, are included. The West and North West of Ireland has one of the highest incident rates of rare disease in Europe. While most rare diseases appear early in life, with sadly about 30% of children passing away before their 5th birthday, many are not diagnosed until adulthood, when it can take 10 years to get a diagnosis. Over the interim years, incorrect diagnosis leads to expensive and often pointless medical interventions, including psychological care on the assumption that the symptoms are all in your head, and in some instances, inappropriate surgery. Taoiseach, there is nothing worse than being unwell and not believed, even though you know there's something fundamentally wrong. Except, of course, it's your child who's unwell, when you can be dismissed by the doctors as just an over-anxious parent. When patients are treated over the years for the wrong condition, this delays access to the appropriate care that could make a real difference to their quality of life, or even their life expectancy. It also places huge yet futile costs on our health budget and denies other patients vital tests and treatments that could transform their care. That's why getting an accurate and timely diagnosis is so vital for children and adults with a rare disease. But Ireland has about half the number of people employed in core clinical genetic services when compared to our international peers. This results in a 2-year waiting list for diagnostic services that can revolutionise care for patients, particularly children with rare conditions. This is in stark contrast to the 3-month waiting list for the same genetic services in Northern Ireland. To help address this situation, the Minister for Health allocated €2.7 million this year to commence the implementation of a national strategy for accelerating genetics and genomic medicine in Ireland. This was to invest in the establishment of a national office for genetics and genomics, and to appoint 16 staff to build capacity in the field of genomics within our health service. But we are now being informed that some of these posts have not even been advertised because of the HSE moratorium on recruitment. Taoiseach, obtaining the diagnosis is a long and tortuous journey and wasteful resources within our health system if not targeted properly. So I'm asking you to personally intervene to address this deplorable situation, which is compounding the cost overruns within our health service.
Thank you, Deputy. Taoiseach.
Thanks very much, Deputy, and you're absolutely right. Rare diseases are not that rare, and certainly not if you put them all together. It includes diseases like cystic fibrosis, like haemophilia, like muscular dystrophy, for example, and often it's a delayed diagnosis or a misdiagnosis, and the sooner patients and families can get that diagnosis, the better for everyone, not just themselves, but also the wider health service. As the Deputy knows, we have a 5-year national strategy in relation to genomic resources and rare diseases. 2.7 million has been allocated for the implementation of this strategy in its first year, and that includes the establishment of a new National Genetics and Genomics Office. I understand that recruitment of some positions has been affected by the agreed controls on recruitment of management and administration grades, but I am advised that recruitment should now progress in the near future, and I will make further inquiries in that regard. I should say that to help meet existing demand, specialist roles have been allocated to the following locations: 6 genetic cancers to Beaumont, to HSE West and North West at Galway University Hospital. There's a campaign underway. For Children's Health Ireland, the post is advertised. For Dublin Midlands, which is St James's and Vincent's, the job specification is in development. For the South West, which would be based in Cork, the post is progressing. And then for HSE Midwest, which will be based in Limerick, again, that post is progressing too.
Thank you, Taoiseach. Deputy Naughton.
Taoiseach, even after the tortuous road to diagnosis, patients in many instances have to educate the doctors that are treating them. That's because the expertise doesn't exist in Ireland for many of the conditions due to their rarity. To address this, the EU Cross-Border Directive mandated the establishment of the EU reference networks to link rare disease clinicians right across the EU. Irish doctors participate in 18 of these 24 networks. But to ensure our continued participation in the existing networks, as well as the 6 remaining networks, we need to modernise our patient registers and establish electronic patient records. This will allow our patients to access the latest research and drug trials, as well as assisting in policy development. But as you know, the electronic health record programme has been paused until the new Children's Hospital health record programme is implemented. Taoiseach, this seriously threatens patients' access to these vital EU networks and our participation in the emerging European health data space being developed at EU level.
Taoiseach. Thanks, Deputy. As I said earlier, rare diseases, when you take them all together, aren't that rare, but some rare diseases are very rare. And when you do have conditions that are 1 in a million or 1 in 5 million, then it's not possible for us to treat those patients on our own. We have to cooperate internationally and particularly at a European level. And we definitely need better patient registers. There are many conditions for which we don't have a list of all the patients who have it, and that makes research in particular very, very difficult. That isn't dependent on there being electronic health records. There were national patient registers long before there were electronic records, but obviously one would help the other. I don't know the detail as to where that is at the moment. I think there is a requirement for specific legislation in relation to that, but what I'll do is I'll ask the Minister for Health to come back to Deputy Naughton with a more detailed reply.
Thank you, Taoiseach.